If you're experiencing any of these uncomfortable symptoms of the transition to menopause, but you're a little concerned about going on antidepressants, or you don't want to do something that feels as extreme as hormone replacement therapy, we have a lot of naturopathic options that can make the transition more comfortable and more gentle as you transition into this normal state of menopause. Hi, I'm Dr. Angela McKay, chiropractor and naturopathic physician, and I'm here to talk to you on Motivational Monday about treatment for menopause. So if you are going through menopause, know that it is a perfectly natural, normal phase of life, but it can come with some rather abrupt and uncomfortable symptoms depending on your situation. So if you were to go to your primary care medical doctor, the first line of treatment for hot flashes and night sweats and the irritability and mood changes that can come along with menopause is to prescribe antidepressants. And so when your doctor does this, he or she is not doing it because they think that you're depressed or that you're crazy. What they're trying to do is to mitigate the response that your brain has to the changes in your body, where it can overreact and create hot flashes or chills or irritability or mood swings. And so these things come along because your hypothalamus, which is a part of your brain, is looking at all the things in your body and trying to generate homeostasis, but your adrenals and your ovaries are doing different things and they're putting out inconsistent hormone levels. And so the hypothalamus responds, and it is one of the major jobs of the hypothalamus is to regulate your body temperature. And so it over responds and creates a lot of heat and gives you hot flashes or night sweats. And no wonder that is creating some irritability. It's very uncomfortable. So the role of antidepressants in treating menopause is really to calm down the nervous system so that you don't get such a big reactionary swing in temperature or hormonal influx. And that is how they work. However, they come with a lot of side effects. So already with menopause, you may be having some vaginal dryness, maybe lacking some energy, and having a big dip in your sex drive. And antidepressants are well known for just absolutely killing your sex drive. So you may have less hot flashes, or you may have a better mood, but you may still be dragging and you may still have nothing in the sex department going on. In addition to all of that, antidepressants come with other side effects, and they can be very hard depending on the particular antidepressant that you would be prescribed, very hard to come off of. So you can't just quit them cold turkey without a significant withdrawal response. That could take months to a year to fully come off of those medications. So they may not be the ideal medication for you. Other things that your medical doctor may have to offer include hormone replacement therapy, and that may be a little tricky depending on your situation, especially if you've ever had breast cancer or you have a family history of breast cancer. There are some things there that you may want to steer clear of. Those also have some side effects as well, and it's not a one-size-fits-all perspective, but usually the prescriptions, and there are many different prescriptions for hormone replacement therapy, that are available through your regular medical doctor. Some can be really beneficial, and some can have more side effects than you might be looking for. If you're experiencing any of these uncomfortable symptoms of the transition to menopause, but you're a little concerned about going on antidepressants, or you don't want to do something that feels as extreme as hormone replacement therapy, we have a lot of naturopathic options that can make the transition more comfortable and more gentle as you transition into this normal state of menopause. From a naturopathic perspective, we really look at supporting the hypothalamic, pituitary, adrenal axis in a different way. A lot of what we do helps support the adrenals and regulate that there, and also regulates the hypothalamus, and in turn can reduce hot flashes, night sweats, and irritability and some of the discomfort as you're going through the transition to menopause without the side effects. So there are a lot of herbs, teas, and supplements that you can take to really get a handle on hot flashes and night sweats and irritability and mood swings that don't have the side effects associated with antidepressants, and are things that you can quit cold turkey. You don't have to wean off of them. There isn't a big long backlash of side effects or withdrawal symptoms coming off of the herbs. We also, as a naturopath, have other tools in the toolbox, including bioidentical hormones that can be used topically or can be used internally in different ways and at lower doses, and in ways that mitigate possible risks of cancer or other side effects that might be associated with more commercially manufactured hormones. If you want to know more, I recommend setting up an appointment for a naturopathic consultation, and we'll be happy to answer all your questions. If you have something quick we can answer now, just drop it in the comment box, and more on menopause later this week. So now we're 2 years out, and she is hot flash free and feeling a lot better. She's a lot more energy. Sleep is still good, and she's managed to transition and is doing great. And today it's Testimonial Tuesday, and I want to talk about a case study with you of a 54-year-old woman who had previously been treated for breast cancer. She'd had a double mastectomy. She'd spent some time on tamoxifen in response to the breast cancer. Tamoxifen in and of itself puts you into a menopause-like state where it just immediately shuts down estrogen reception because its main goal is to really try and reduce the chance of estrogen-sensitive cancers to grow. So she had already been through that. She was off the tamoxifen. She had a really high-stress job and 2 teenage kids, married, and a very busy type A, hard-working, driven person. And her world was really being turned upside down by hot flashes, insomnia, night sweats, some irritability. As you can imagine, if you're not sleeping and you're having hot flashes, you're not going to be fun to be around. And then it was also impacting her relationship with her husband. Sex was very painful, and she had a lot of vaginal dryness that was very uncomfortable, even just during her workouts and running. Any sort of intense exercise would cause some discomfort in the genital region. So she first came to me, and she didn't want to do antidepressants. She had been on them at some point shortly after college and didn't want to go back on antidepressants, which are the #1 treatment usually for hot flashes and night sweats. And so we really worked together to get an herbal protocol together. We worked really with supporting her adrenals. We think of them as being your stress hormone center, but they do a lot more than that. They work to give you energy to get through the day. They're part of your fight or flight complex, that's true, but they're also part of your circadian rhythm and the hormones that work through that cycle to regulate wake and sleep. So we really work to support the adrenals, because if your ovaries are going haywire, somebody has to pick up the slack. A lot of times that's the adrenals. That's what helps push you through and keep you going, and they can get depleted and go a little wonky themselves. So we started with an adrenal complex that included ashwagandha, rhodiola. We included some leonoris, which is also called motherwort, that can be very calming and soothing. We included licorice, which is also an adrenal supporting herb, along with some sage, which can be very drying and help with the sweats. Along with that, we had her take that in nettle tea, which is very nutritive. It has a lot of minerals and nutrition in it, and it's been used as a food for centuries, and can be very nourishing along with the other herbs. Because sleep was so disrupted, we had a different blend of herbs for nighttime that included some calming and soothing herbs, along with some very gentle adrenal supporting herbs. And that included herbs like skullcap, passion flower, California poppy, schizandra, which is astringent in Chinese medicine, so sometimes it can help with night sweats, along with sage, which is also drying and helps with night sweats. The other big piece that we recommended was regular exercise. So exercise has a way of increasing your core body temperature and helping to give that information to the hypothalamus in that feedback system that regulates homeostasis. And so in some ways, exercise is a little bit like getting all your heat out at once. And there's been research to show that regular exercise, raising your core body temperature, does help reduce the frequency and intensity of hot flashes in and of itself without the herbs and other things. But it definitely had a cumulative effect for this patient. These two things combined, which is a very simple formulation, but tailored specifically to her and her needs, that alone reduced her hot flashes to by at least 90%. And then ultimately, we did opt to do a very low dose of local estrogen cream for the vaginal dryness. So this helped her significantly in terms of being able to engage in intercourse without pain or difficulty or discomfort, and to be able to enjoy connecting with her husband again. All of these things combined led her through the transition to menopause, and she was able to have more energy and get back on track. And so now we're 2 years out, and she is hot flash free and feeling a lot better. She's a lot more energy. Sleep is still good. She does still take the tincture for sleep, but she doesn't need the hot flash tincture for the daytime anymore. And she's managed to transition and is doing great. So this is one case of many that I've seen of women going through menopause and having some difficulty with the transition. I chose this case to talk to you about because it's a little more complicated because of her history of breast cancer, but just know that wherever you are, we have a lot of different options to help you through this transition so that you don't have to suffer through it to get to the other side. It is Wake Up Wednesday, and if you are dealing with menopause, waking up may not be that easy. So a lot of times sleep disorders accompany menopause. Probably 61% of women have some insomnia at some point during the week while going through the transition to menopause. Insomnia is defined as taking longer than 30 minutes to fall asleep, getting less than 6 hours of sleep a night, waking up too early, not feeling refreshed after a full night's sleep, feeling sleepy and tired throughout the day, and having anxiety or worry about sleep where you're looking at the clock every 5 minutes and stressing out because you're not falling asleep. Which definitely doesn't help. Insomnia leads to being anxious or irritable or cranky. It can lead to brain fog, not being able to perform at work or at home, being forgetful, and just not managing your life very well. It can lead to headaches, anxiety. It can lead to eating more in an effort to try to find a boost or energy to make it through the day. And it can be really problematic for women going through menopause. During menopause, you start to diminish production of hormones. Everybody thinks of estrogen, but progesterone also starts to diminish. And progesterone is a hormone that supports sleep. It supports falling asleep, staying asleep, and relaxation. You also start to lose testosterone, and maybe you don't think about testosterone much because you think it's a male hormone, but testosterone can be important for giving you a boost of energy, for boosting your sex drive. And so without testosterone, you can really find that you're very droopy. You don't have the initiative, you don't have the drive, not just for your sex life, but for everything else too. Additionally, sleep can be disrupted by hot flashes. So if you're having hot flashes that wake you up at night, night sweats, that sort of thing, it's impossible to get good sleep if you're having to take the covers off, put the covers on, get up and change your pajamas, get up and change the sheets. And it can be very problematic and disruptive if you're waking up 3, 4, 5 times a night with hot flashes. Some things that can be disruptive for sleep that you have some control over can be any number of medications. So you want to evaluate what medications you are on, when you take them during the day, and if they can be disrupting your sleep. Supplements, a lot of times people think, oh, it's no big deal, it's over the counter, it's totally safe, it's natural, but that's not the case. Supplements do have an effect, herbs do have an effect, and you want to be careful with those as well because some of them can be problematic in terms of helping you get a good night's sleep. For instance, you don't want to take your B vitamins at nighttime. They're better to take in the morning. You would want to take magnesium in the evening though because it has a calming, relaxing effect that can help promote sleep. Diet can be really important. You want to avoid spicy foods at bedtime because this can sometimes lead to more hot flashes or night sweats. You want to not be too full when you go to bed, and you also don't want to be hungry because either way, that can keep you awake or wake you up. You don't want to exercise at bedtime or before bedtime. Exercise in general does help with falling asleep, staying asleep, and promoting a sense of well-being, but you don't want to get too revved up right before bedtime. So I'd say keep exercise at least 2 hours away from bedtime, if not further. Again, with diet too, another thing that can interfere with sleep is a nightly glass of wine. If you enjoy wine, that's fine. I would keep it to a minimum and away from bedtime. It may cause some relaxation initially, but it does tend to create poor sleep and wake people up. And for instance, I get really hot and flushed if I'm drinking any kind of alcohol, so it leads to more heat and more flushing and more sweating, potentially hot flashes at night. So maybe have it early on with dinner and only have one glass, or maybe only do it a few nights a week, but watch your alcohol consumption as well. You want to wear loose, comfortable clothing to bed, preferably natural fibers that breathe well. So we're talking cotton, bamboo is really wonderful, linen, those are all good. You don't want to sleep in polyester or polyester sheets. Those tend to trap in heat and make people really warm. You want to have a cool room, ideally set below 65 degrees to promote sleep and reduce hot flashes that way. You want to go to bed at a regularly scheduled time. So same bedtime every night. A lot of people recommend waking up the same time every day, even on the weekends. I don't mind if you sleep in a little bit, but you don't want to sleep 4 hours, 5 hours a night during the week and then 12 hours on the weekend. You want to balance that out a little bit and get 7 hours of sleep at least a night during the week, and 8 to 9 during the weekend I think is fine. Additionally, if you're waking up with a headache or you're waking up and not feeling refreshed at all, you want to make sure that you rule out sleep apnea. You don't necessarily have to stop breathing. You don't necessarily have to snore to have sleep apnea, but it is one of the big things that can lead to high blood pressure and heart disease and all sorts of other things, but also leave you really tired, headachy, and unrefreshed during the day. So if you're not waking up feeling like you're rested at all, that's one big thing you want to talk about with your doctor. So hopefully that gives you some guidelines for starting to get some better sleep so that when it's next Wake Up Wednesday, you'll be right here, bright-eyed and bushy-tailed with me. Thanks. And we're talking about menopause this week. So I've talked a lot about the biophysical nature of menopause, some of the changes that happen in your body, but I want to take a few minutes today to talk about the spiritual and emotional effect of menopause. So there are a lot of things that happen during this time that are a big change. And I don't remember if you can think back to when you were going through puberty, but there was a lot of emotional upheaval. Things were changing dramatically in your life. And menopause is really much the same, right? This is a humongous transition, and it can be challenging for some women, maybe some more than others. And you start to realize that you are no longer in that phase anymore where maybe you wanted children and didn't have them, maybe you had children, maybe you wanted more children, maybe you wanted to spend more time with your career and on your career, and you had these goals as a young woman that you were looking forward to as you age. You had this vision of what your life was going to be like, and then you get here and you're like, how did I get here, right? Because you're starting to realize one phase of your life is done and you're moving on to another phase of your life. That's normal. So if you're experiencing any of those feelings, it's a transition. It's like birth is not easy for anybody, and you can consider menopause sort of your rebirth because you're becoming someone else. Right? You're transitioning into this new role in your life, and it's foreign and it's new, and it can be challenging. It's not unusual to start to reevaluate your life at these times, your relationship, your career, and where you want to go. I want to tell you now that wherever you wanted to go when you were younger, if that still feels important to you, it is not too late to course correct. Just because you're in your 50s, 60s, 40s, whatever age you are, you can still go for it. When I went to naturopathic school, I was on the later end of the people in my class. I was in school from my late 30s to my early 40s, and then there were women there who were in their 50s, 60s, working on their second career. So wherever you are, it is not too late to start moving towards what you're passionate about, what you want your life to be about. One thing that can be really helpful during this time of transition is journaling. So journaling really helps you get all those feelings out there, whatever they are, and there's no judgment there. It's only for you to look at. You can burn it, you can rip it, you can shred it, you can do whatever you want to with it, but it helps you get that out so that you can take a look at it and examine, where am I really? What do I really feel about this? Another thing that can be really beneficial during this time is exercise. You're exercising, you're moving, you have thoughts going through your head, kind of like when you're in the shower and you finally get a moment of peace to yourself. You can have that experience with exercise as well. The bonus of exercise, though, is that it helps protect bone health. It also builds muscle mass, and it also helps with balance. So one of the first things to go as you age is balance. So age gracefully, age well, age healthfully. Also feel really very comfortable in your body, and know that whatever age you're at, you're still capable, you're still strong, and you can develop a sense of confidence and self-esteem with being able to move and do things. We've talked about the physiological changes that happen during menopause. A lot of times we don't talk about the emotional changes or the spiritual changes. No matter what herbs I've talked about, no matter what techniques for getting through menopause I've talked about, the transition is not ever going to be complete until you address the spiritual and emotional transition as well. And in naturopathic medicine, we consider the whole person, and wherever there's a part that's stuck, if it's not moving, we consider that an obstacle to the cure. Now, menopause doesn't really need to be cured. It's a natural process, but to do so fully is going to take looking at yourself all the way around from every aspect, including this one. And it's Friday, we're talking about menopause, so I'm going to talk about my Friday favorites. So I want to bring up some things that I have found really helpful for me and for some of my patients that maybe we haven't talked about in the previous videos. So one of the things I did mention before was wearing natural fibers. This can help with hot flashes. You want to have natural fibers for your bedding as well, so no satin, polyester in your bedding. But for you personally, if you tend to get chilled along with the hot flashes, you want to make sure that you layer. So finding lots of nice layers that you can take on and take off easily can be important. And you want to wear natural fibers as much as possible. This includes cotton, linen, and bamboo. Now, I love bamboo. It has a really nice drape to it, so you can have sort of slinky fabrics on that don't hold on to a lot of liquid, and bamboo sort of wicks things away and dries off really quickly. So if you're having sweats, really do recommend bamboo, and there's a link here to my favorite bamboo pajamas, so you can pick up some of those and see how that feels to sleep in. You want to avoid synthetic fibers, so things like polyester and spandex. Oh my goodness, yoga pants are the worst. So you sweat in these things and it holds on to the moisture, and then you don't ever get dry. So yoga pants in particular, I don't like them for anybody. It's okay if you're wearing them to work out, but then you need to change out of them right away because it'll hold in that moisture and then it doesn't breathe, and that leaves you prone to yeast infections, both on the skin and also vaginal yeast infections. Once you feel damp and sweaty, that doesn't ever go away if you're wearing those artificial fabrics. So none of that, please. Stick to cotton, stick to linen, stick to bamboo or natural breathable fabrics. I love exercise. I know we've talked about this before, but weight-bearing exercise is fabulous. I like weights. My personal favorite is kettlebells. That helps with bone density. Muscle mass is wonderful for strength. And balance. So you want to make sure that your proprioception or your sense of where you are in space and your balance is solid, because that's one of the first things to go with age. And you don't want to have a fall or an injury that could become very serious. So work on that with weight training. And then ashwagandha. I love ashwagandha. It seems to be really beneficial to prevent cortisol weight gain, so weight gain associated with the stress hormone cortisol. It also helps support the adrenals and smooth out your mood. It's not jangly or jittery like some of the other adrenal supporting herbs can be, and it is truly one of my favorites. I think it's something that almost everybody can utilize and benefit from. So I like that one for both men and women because it can also be helpful for men during andropause as well. If you have any other questions, let me know. But those are my top faves for going through menopause. I'll talk to you soon.